Hello everyone, can you hear me?
Yes, good morning, Dr. Ahmed.
Oh, no. Yes. So today is an open session regarding the candidate experience of recent Part 1 exam. Um, the result was very good. A lot of candidates passed the exam, along with few setback as well. Many brilliant candidates, they could not make it in the exam, but it was not their fault. It was the fault of the software. The good thing is that they are offering the next exam as free as per the email. They will not be charged. They just need to be consistent in their study. Yes, a few more months of hard work and stress, but they will make it in March, I think. So my advice to the failed candidate is that to continue study, appear in March exam, and you will make it as well. This is a stressful time for the Part 1 failed candidates. I know that, but this time shall pass as well. I've requested many of the candidates from the pass list to share their experience. There are many candidates who passed their exam, but they do not want to share their names in the group. There are 7 people who mentioned that. So the result was, I think, quite good, except for few setbacks. So first on my list is Shabana Koser, if she's there. Shabana, are you there? Mm. Then we have Hosam.
Yeah,
Hosam, can you hear me?
yeah. Can you hear me, guys?
Yes.
Did I just wake up? God. Um, Good morning, everyone. And firstly, congratulations for everyone who passed the exam. And a big congratulations, actually, I think credit is going to Amir because he did a great job. I'm not going to take long starting. So I can see that a few points I need to go through my exam experience. It took me 3 months, actually, to prepare for the exam, which is not ideal to do that. The reason why I decided to do the exam in a short time because I'm moving toward my end of ST5, and it was panicky to squeeze the time and get the exam on time. But ideally, if I have a chance, and if I have a chance to go back on time, I might prepare for the exam early and at the beginning of my training, and I will put 6 months for my preparation. But I think for myself, this attempt take me three months. It was quite tight, panicky, and with work because ideally I utilize most of the weekend to prepare for the exam and working days after staying after work for 3 hours in the hospital to just try to catch up with the things. I was studying alone. Initially, I explored possibility to join a group because I believe group might help to encourage to be commitment for sit and read, and kind of repeating words and sentence together might help to memorize. But unfortunately, in my situation, because I was a bit far, maybe finally the only one in the hospital who doing the exam, I did it alone, actually. So, what's the sources I use for the exam? Initially, to be honest, I was very confused where to start with, where to go, where to do, in keeping in mind the time for the exam itself. And one of my colleagues who passed the exam, he recommended this course to me. Before joining this course, I've been registering left and right where to find a good course to guide. And once I joined the course here with Amir, it was, it was very useful firstly to plan ahead what you need to do and how to study and what resources in hand you need to utilize. And the second thing, um, I know I jumped to the next of the course, but it's important to mention that before speaking about the sources, because if you didn't have a good course in your hand to map clearly what you need to do, it will be very confusing where to go. So when I start joining the course, there's a lot of materials in hand, including where to start with in terms of online teaching. I was using the pathology question banks and Blood Academy and Heme base. So how I start actually, I was reading, I was allocating initially 2 weeks for each system and trying to repeat that in between 3 weeks, sorry, 3 weeks for each system, like 3 weeks for transfusion. During this transfusion time, I go through the Blood Academy. I try as much as the question back. I didn't finish all of them at that time, and also building up the knowledge with the heme base, which is very useful. I was very keen to join the weekly session with Amir in that particular system or that particular chapter of transfusion or malignant or whatever, because it helped to build up the answers and trying to catch up with the most common scenarios. So in the direct answer for sources, number one is this course, number two is this course, number three is this course, number four is him base, number five is the Blood Academy, and number six, a question path, which is kind of all the pathology questions, which is coming tough. I didn't join a lot of the MCQs in the website for at that point because it was just starting coming up all the questions. But my advice in the future, because I noticed that most of the difficult MCQs is being already exposed in this group and in the website, so it might be very useful to look on those at this point because they are very rare stuff and it will be useful for the future. I didn't join the mock exam. I booked for the mock exam, but unfortunately, I was working that weekend, so I was not able to do it. I believe the mock exam is very important to give you a test of the pressure of the exam, planning the timing of the exam, and that will be kind of a cheap attempt of the exam rather than just put all your money in one attempt on the exam and just go through all the kind of timing and pressure. So mock exam might be very useful. I actually planned to do it, but unfortunately I didn't do it. But I believe it's quite important. So talking about the last days of the preparation of the so what I was doing the last 3 weeks, to be more accurately, I allocate every. We'll talk about 3 weeks and then the last week, which would be if the time is possible, Amir. The last 3 weeks, I allocate each week for each system. Please finish it off. I was very dependent on the sources from the course with Amir because when you join the course, he will give you a lot of information like PowerPoint slides and miscellaneous files, and then alongside with the sessions on the website, it helped a lot to plan the last minute because that's the time you grab on your hands. At that time, you will be more focused on approaching the answer rather than gaining more knowledge because at that time you have already utilized 3 months of your preparation, gaining all the information from the websites and him base. And I think you have enough knowledge to pass the exam at that point. The most important now in the last week or few days to plan the answers, how to approach your answers. The exam clearly is more focusing on approaching answers. So you will notice that a lot of candidates pass the essay without even knowing what's the diagnosis of this case because you're gonna lose 1 or 2 marks in the end of a diagnosis itself, but you gain all the approach of putting things ahead. And the Amir course is very focused on that to look on the information you need to put on the answer essay and memorizing the word of what you need to put each one. I'm going to buy a BMW for my friend in Chicago. I can't remember it, but it's very nice memory. You need to keep that on hand. It is very useful because when the time click to start the exam, putting the answer. What I did, I just copy that in the answer sheet, and I start feeling the point which I need to feel. And it's very easy not to lose anything. In spite of that, I forget few things. So it's don't really underestimate how it's important to practice that, and you need to practice. I was sending a few essays to Amir. I was not optimum, to be honest, because I'm very lazy to type on the keyboard. I hate typing on keyboard. I prefer writing in a paper, but that was a challenge for me. So I sent maybe one or two essay with Amir, but I was very keen to join and see what people write, what people say. And in the last minute, I think going through the resources he sent it on the course and going through the videos, just listen to the video, open the video, what's he saying about that answer, pick up the main things and plan your answer. Um, and so the last bit is the exam itself. This exam is exceptional. I believe, I'm very confident that all the candidates who join us in this group, they have the enough knowledge and confidence to pass the exam. The only, I think, problem will be the technical problem, which is really make few of our colleagues maybe lagging behind, but I'm sure they will do very well in the next attempt to finish this headache. And I understand it's a free attempt, which is going to happen. I know the pain of preparing for this again. It could be taking a lot of time, but I'm sure they were going to pass it. The exam was very stressful in terms of timing. I believe this exceptional circumstances, but unfortunately, we don't have any other experience to talk about. It was more technical issue. You need to be very familiar with the technique, with the exam system, how to put your answers and managing the time. I think time is a challenging, especially in the MCQs, because if you think more than required in those questions, you might lose that mark. You need to pass over. There is a clearly a questions in the exams that meant not to be answered. I will say that way. You will not be able to answer it. Even if you give all the resources in hand to look for an answer, you will not find an answer. So just pick whatever, move to the next questions because you need to gain more. It's important to finish the exam more than making sure if every single question is correct. So give each question its time, regardless if you got the answer correct or not, move to the next, flag those questions. You can come back if everything's went. I believe I have 15 minutes before finishing the exam to come through the exam, but unfortunately I didn't finish, and it's kind of being shut out of the exam. I lost the last few bits. So timing itself is very important. Exam could be challenging. Putting all the memories and the words and the advice from the course in the essay, you'll find the essay is more easy. This course, what I'm going, sorry, I'm taking a long time. This course, Amir did a really great job. You don't need to do any other courses. I already booked for different courses, which is more costly. It cost me £500, but I cancel it in the last minute because I feel it's not required really, and I don't have time for that. Most of the courses done by other people is they're more expert, they're more consultants, they're more seniors. They might guide you with knowledge wise to do things for all long time and just go through it. But Amir is very, he is, I would not say he's junior, but he's very close to our training time and our training, how it work actually. And he's very helpful because he's recently have an experience with it, and he can put you on a guidance. So I think really the course is very important, and I really appreciate it. Thank you for Amir. He is personally having a very big threshold. I don't know how he's managing those emails, because even he's putting his personal email. He's very responding. I know that's out of the answer, but it's important to mention because Amir is very helpful, responding, coming back to answer with open heart for all the candidates and helping each one by one. So I think I'm just going to say a big thank you to him for his great help and support. And I think without him, I think we'll be more lost uh, everywhere rather than just putting things together to pass the exam. I hope that's helpful.
Thank you very much, Hosam, for the nice words. Here is a question for you. How was your experience with MCQs? Were they difficult, especially HB electrophoresis and blood bank?
You talk about the exam MCQs or the samples we have outside?
The exam MCQs in general, were they difficult? How did you find them?
I mean, to be honest, I was a feeling. I'm coming with the impression I'm failing the MCQs. I came out of the exam. I'm failing. This exam is done. I'm out of the MCQs because the questions are really tough. quite difficult questions and very tricky. So one of the question, for example, they just given they are very tricky. They give you the questions and they're asking about, for example, a woman who's pregnant with a positive blood group, and they are asking you where to go with after that, ruling out. If you don't look on that positive bit, you cannot rule out D and then going forward. So the MCQ is very difficult, to be honest. And regardless, if you even finish all the questions in Blood Academy and the question path, you might be able to do 50 to 60% of that MCQs, and after that, your own kind of luck, experience, and looking on things to get things forward, you might get the passing mark after that. But even with all the resources you have, it's tough to go through the MCQs. I mean, that's my experience. Could be this exam is only one of the tough ones, but it might be really tough. And your MCQs, what you're putting in a group, they're very complicated and very difficult. And sometimes I ignore them. But after passing the exam, if I didn't pass the exam, I think I'm gonna go back to them again because they are the stupid, difficult stuff coming in the exam, and nobody will believe that.
They are all made from the guideline recommendations. We go through the guidelines and its a recommendation, then put the recommendations in the form of MCQs. So that once you go through it, it means you know about the recommendation. Another candidate asked about IT issues. We hope that there will be no IT issues in the next exam. If there is an IT issue, they would have given you a number whom to contact. Thank
Yeah,
you
no,
very much.
no problem, no problem. Thank you for having me. I mean, and best luck for everyone.
And good luck for part two. I think I have added you to the part two group.
It will be
So
all your responsibility now. Thank you very much, guys. Have a good day.
thank you. Welcome. Yes. Do we have Nora Hebard in the list? Nora just messaged that she passed the exam. I think many people are receiving the email late. Okay. Do we have Amy here?
Dr. Amir, I'm here actually.
Not doer, yes. Yes, you can go on.
Yeah, thank you so much. So actually, I'm Naja. I'm working as specialist in hemostasis and thrombosis in UK. So I'm really thankful for this opportunity to share my experience. I really wish it will be helpful. So actually, I will start by the timeline. I started thinking about this exam around 1 year ago, and exactly when the results, autumn 2024 results were released, and then I start thinking, shall I? Is that? I mean, I start putting the exam in my head. So one of my one registrar colleagues actually gave me the link of Dr. Amer's group, and I spent the first 3 months, to be honest, just inactive, just reading posts, observing, and having an idea about how things. And then by January 2025, I was decisive about going to the exam. And then I made a group of, I said we had two partners, and we made a plan, very good schedule plan to cover, and we started. So we have done good start in the beginning. And then we completed all junior hematology in very good way. We were using Blood Bank Academy, and we used HemeBase, we used BCSH guidelines. And this first chapter was kind of eye-opening. It was when we have done the first trial, we knew already that we should not rely on Blood Bank so much, so we stopped using it. We were stuck on the essays. There were no any guidance on how to approach essays. So we knew actually what are the best resources to use it. And what our conclusion was is just to stick with Dr. Amer guidance. There were, especially on the essay section, the approach was very clear. It is exactly what we do in our day-to-day practice. And there is no, we were attending the Saturday sessions, so there is no, all the questions are answered actually. We are not left with unanswered question or confusion. And especially the part of management was completely in line with the guidelines and with the updates. So I personally, I decided in terms of the essays was the most confusing part for me. And then once I start attending Dr. Amer Saturday sessions, so I that thought that's enough for me. I have to stick on this. And then I attended a Marsh course. So when I attend the Mars course, I have done only general hematology at that time, but I felt I need an kind of induction to this exam. So this course for me was kind of intensive induction. I need to know what is important, what's things which needs to be done in depth, and particularly in terms of transfusion. At that time, I had no idea about how transfusion looks like for FRCPath exam. So I decided to go for this course, and it was really an eye-opening. So after this course, I completely changed my approach, how to my method, how to approach the exam. I reorganized myself. I made another schedule, and then um, after the course, unfortunately, I was given new job responsibilities where I completely stopped. I made a long break for the exam. I need to concentrate on my job. And it was around 2 months without, I haven't done anything. But I was indeed reassured as I have already this induction. I have already made a plan how to go forward, and I start feeling that is doable. So I say in May, and like middle May, then this is exactly where I restarted seriously. And when I restarted, I restarted with transfusion, and my biggest weakness was transfusion and oncohematology because I have been doing hemostasis and thrombosis for years. So I attended the transfusion course, essential transfusion, and this was as well very important. After that, I completed the oncology. I needed to get holidays, 10 days to complete the oncology. And this is, again, my advice to you is to use the intensive blocks. So the intensive blocks are very useful, really. Get intensive course and then get some leave for 10 days or 1 week to complete one chapter, and then um, go back to your work. And then again, this is the way, this way of intensive blocks um, give you the global knowledge you need. You push yourself to study, and then you feel reassured. You're not panic that, oh, I spent 2 months now, I still didn't complete all the malignancy, or I'm still stuck on transfusion. So that's my advice. Once I finish this the oncology and the transfusion, I spent 1 month, to be honest, in transfusion, and was enough with the transfusion course. So I felt myself okay now. I feel I'm ready for the exam. I have done general hematology, I have done transfusion, and I have done oncohematology. So it remains on the thrombosis hemostasis, which is not a big issue for me. So what I've done, I want to reassess myself again, and I attended the second course of Dr. Amer, which was, I think, in July. No, it was in June, I think. Yeah, so I attended this course, and this course was completely different than the first one. I was active in the course. I felt like I assessed myself, really. I felt like I acquired the knowledge required for this exam. So that was in June. Then after that, I attend the intermediate transfusion course, and that's really completed all my transfusion deficiencies. Um, I was attending Dr. Amer regularly Saturday sessions, and I was after that repeating these videos. Actually, my Bluetooth was always in air for the 4 months before exam. I was always hearing only Dr. Amer's while I'm cooking, while I'm cleaning, while there is always. That's how I was revising the essays, only by putting them this Bluetooth in my ears. So this was only, I haven't done it. I mean, I didn't, was only my resource, is Dr. Amir courses, two of them, the Saturday sessions and the transfusion courses, both of them. So I start slowly feeling that, yeah, I can do the exam. But at that point, I never practiced essays. Dr. Amr was every time saying, guys, you need to practice and send to me. And it was really good opportunity, but I never felt confident to do it. As soon as I start typing, I feel like I'm still struggling with the essay content. First, when I'm done with the essay content, then I have to start practicing typing until the mock days. So I subscribed in the mock, and that was it in September? It was in 6 September. That's only after this mock. This mock was really good opportunity to put yourself in the exam condition and to start practicing. And when I passed this mock actually, and not only because I passed, it was motivating for me. I felt that I can do this exam. The essay parts in the exam I can is not hard for me anymore now. I can finish on time. I can type on time. And since that, I start practicing essays at home every day. I start to type two essays, and that was really helpful. And we've got actually an individual feedback. Um, and which was really helpful and in eye-opening. Uh, Now the MCQs, I used after in the first month I mentioned when we started using when I was in group and we start using Blood Academy. We realized we subscribed in both, to be honest, in Blood Academy and Path Question, to see which one is more reliable. So we had the conclusion that we should just give up Blood Academy and we start using only QPath. So I went through all the QPath questions, all. And when I was going through the MCQs, whenever I find the extended MCQs, the extended question, I just print them, because those MCQs needs repetition. I was printing those extended questions. I was printing things which I feel I might forget them. So that was the part which I was reserved to revise just before the exam for each topic. Um, Dr. Amir's MCQs, I was following up to around 100, I think, and then I lost track because it's quite is as many mentioned, is not really user friendly. So when I use in the mobile, sometimes I can't access, sometimes I have to go through all of them. So that was one of the difficulties. But I used up to 100 question. I was following when they were being posted in the group. I was really following them. They were really useful. um so the last month, the last, say, month and 1 month and a half of the exam, I needed to take a leave. So it was in paid leave, because I, I I'm I can't do two things together. So either I do my job perfectly or I study perfectly, and that's not a really good thing. And I know that not many of you struggle with this, but I personally struggle with it. I needed 1 month in paid leave, and in this 1.5 months, I made a plan of every week topic. So I every day I need to spend 2 or 3 hours listening Dr. Amr courses, the videos of essays, and then I have to do 40 mixed MCQs, and then I have to revise the theory. So the theory is him base, or the stuff which I have printed, or my own notes which I have taken. I have used BCSH guidelines in just some selected topics. So if you see him base is really useful, but in some topics there is not much. You need really to use BCSH guidelines, and you will know that. So when you go through him base, you will feel that, oh, that's not enough for me. I need to go to check the BSH guidelines. Sometimes the treatment is not that clear. So I use them, but selectively. Yeah, so in the last month, I was as I mentioned, every week topic. And in the last 2 weeks, I have done more intensive revision. So I was, um, again, I remember the last 2 weeks, I went through all Dr. Amir course, because Dr. Amir, after the course, he will send us a link of the videos. So I went through all the course in just 2 days and was really helpful. um, I found out in the end that the essays which Dr. Amir covered in the course, when I combined with the essays which were covered during the Saturday sessions, that's covered mainly all the essays which we need. Those essays which were missing, I completed with QPAT essays. QPAT essays also are good, but they are quite of silent essays. It's not like Dr. Amr essays. I just completed the essays which Dr. Amr didn't cover from QPath. Yeah, so that's how I prepared. Um, if I want to give some takeaway notes, actually, this exam is not is it a shallow, I mean, shallow preparation is enough? No, this needs in-depth preparation, needs a dedication. So for example, in MCQs, um I just give example. For example, I don't think how many of you knows that Altuvoct, which is the newly ultra enhanced half-life for hemophilia, is name is Ifanas ectogoc alpha. How many of you knows it? And even consultant doesn't know. Expect a such question in the exam. This is really in depth, especially in the MCQs, and need you to do in-depth preparation and needs repetition, repetition, repetition. You would need tables, you would need diagrams, and this all actually was provided in Dr. Amr course. So I used this resource of Dr. Amr course, which I've done in March, as the base, and I was adding everything. For example, I needed a table about inherited bone marrow syndromes. I asked ChatGPT to make a table for me, and I amended it, and so I just completed them. But these resources are very valuable, very good tables, and for every topic. Yeah, and the mutations and what else, the the targeted therapy, the immunotherapy, the monoclonal antibody treatments. These are all questions you can expect in the exam, and the tables were all given in Dr. Amer course. Yeah, so that this is the first takeout notes. Second thing is, exam is completely doable, and it started by making a clear schedule always. And if you lose track, that does mean you just give up. I spoke about my timeline just to say that this exam is preparation is not linear, because we all have commitments, we have families, we are not just graduate student where we sit and study. So if you lose track, you can always restart. The other thing is, if you it's all about how you look to this exam. If you look it as something doable and easy and break it down to small patches, it will be easy. If you think, oh, it's impossible, oh my god, people didn't pass it, oh my god, my friend prepared for I don't know how much and he failed 2 attempts, then it will be impossible for you. So it just make it easy and take it easy. The other thing is, Dr. Amr courses and resources are, for me, was all in one. So it is all in one. It's completely full package for MCQs, for essays, for resources, for um, updated guidelines. I mean, we were receiving updates on time. If the guideline, for example, research guideline is released today, you will see in the group that this guidelines is there, and you will update your essays. So it was, I to be honest, you don't need to do anything else. You just need to use the full package of Dr. Amer, and that's really, I think, would be enough. The other thing is repetition is really essential. The transfusion, you need to do you need to revise the transfusion in the last minutes? That's what I can tell you. The transfusion question needs to be, I mean, the way the question are asked, that require you to revise the transfusion just before the exam. So what shall I say again? Use intensive blocks, as I said. These intensive blocks help you to get the full or the main knowledge in short time and reassure you. So after you get, for example, intensive blocks on hemostasis and thrombosis, you need to get apply leave. I mean, plan for the exam 6 months in advance and apply for your leaves. At 10 days, finish all the hemostasis and thrombosis, and then do the essays at your inconvenience. MCQs on time, follow Dr. Amer MCQs. It's all come with, is not, this exam is not something to rush. It's something, it's a journey. And to help yourself in the journey, I think if you are a registrar or whatever you're practicing, if you are practicing hematology, every patient look as if you are having a FRCPath assay. So every patient you have, treat it as an assay. When that's the way, when you start preparing in the exam, you don't feel that you have so much things to do. You already, all what is clinical parts, you have already. What was challenging for me, why I needed all this long time, because I was not practicing oncohematology for many years, and I would just try to make sure I will not use blender in the exam. Like I will talk about bone marrow transplant when it's never used. So it was really challenging for me, but I don't think this is an issue for you all. And I think you would need maybe shorter than the time I needed it. What else? Yeah, in terms of the essays, I think I noted that people now passing essays more than before, and that's the impact of Dr. Amer, really, because I don't hear many people now complaining of essays, because now there is very clear structure, and those mnemonics, what I've done actually when I started the exam, there is a space in the exam where you can write notes. As soon as I started the exam, I wrote this mnemonic there, and and then I just followed it. It was already in my brain, but just when you panic, you tend to forget things. So I wrote the mnemonic there and I followed it. For example, in the essay, you start always clinical assessment, which include history, clinical examination, investigation, consultation, and all these things. It is always Dr. Amer is actually following the same structure in all his essays, and that's by attending, you will just eventually follow this approach. What else? I try to be actually comprehensive. I think that's all. Do you have any questions?
Thank you very much, Najdo. Your approach is very, very right, and I hope you will pass part 2 exam in first attempt as well.
Thank you.
Thank you. Khalid, if you are there, please. Khalid Ahmed.
Hi, Amir. Thank you for giving me the opportunity to share my experience today. And congratulations to all those who have passed, and best of luck for everybody who's taking the exam in the next attempt or in the next setting. My experience is a little bit maybe unusual experience, but I'll be happy to share it so if people can benefit from that. So starting the duration of preparation, I started preparing roughly about 4 months before the exam. So I think that is the minimum duration that you will need to do intensive preparation for the exam, not less than that. Preferably, if you start 6 months before the exam, I think you'll be able to do things at a relaxed pace and not in a rush. So I would really advise you start preparing seriously, intensive preparation at least 6 months before you appear for the exam. For me, when I prepared this exam, I was rotating in a DGH hospital, and my schedule was not very busy, which helped a lot actually. So that is something to look at if you are going to appear for the exam and you can afford to be in a setting where your clinical duties are a little bit lighter. That will help you by finding more time to study rather than doing it while you are in a very busy rotation. For me, I studied mostly alone. I started with a study group with 2 or 3 colleagues, but then I found it very difficult to harmonize the time that we study together, and sometimes we missed sessions because some people were not able to join. So I ended up studying alone, which is not a problem. I think if I sort of prefer to do that in most of my previous exams as well. So it's not a bad idea if you prepare alone as well. The sources I use are very similar to what my colleagues describe. So starting with the heme base to give a basic introduction to the topics that I would like to review for the exams. I didn't spend a lot of time in the heme base. It was just a quick read to give me a good revision of the basics of all the topics that I require for the exam. I tried to go through practical hemostasis, but I found it sometimes very detailed. So I didn't go into very much details in the topics there. For me, I think what was written in the heme base was a very good introduction. But again, as previously mentioned, some of the topics in the heme base are short, and you kind of feel that you need to go and add to that information from the guidelines. You will probably pick these topics while you are reading through, and some of the topics needs updating as well. Other than the heme base, I focused much on studying from the PSH guidelines. So I didn't put these as additional sources. I usually went to the guidelines straight when I found information difficult to get from other sources, because the PSH guidelines are written in a very well format. For any topics, they will cover the diagnosis, they will cover the risk stratification, they will cover for you how to approach the patient. You don't need to read all the guidelines from A to Z. You will find the sections which are important in the guidelines highlighted, and this is very good in the structure of writing BSH guidelines. So if you just open the guidelines and go through the bolded areas, you will cover a lot of the information which is required. So these were the main sources that I used to get the information for the topics in the exam. Regarding reviewing questions for the exam, I did the pathology question bank and the Blood Academy. So I felt the Blood Academy MCQs are closer to reflect the exam topics. The knowledge in the pathology question bank is really good, really useful. The MCQs are very challenging, but I sort of felt that some of the ideas presented in the pathology question bank are really too tough or too difficult to appear in the exam and might not be the focus of the part one exam. Again, the FRCPath exam is a standard exam that tests your knowledge as a trainee registrar in hematology. So it's not designed to test weird ideas or anything like that. It's designed to test the basic ideas of hematology training. So, but nevertheless, I got a lot of new information from doing the MCQs from the pathology question bank. With regard to the Blood Academy MCQs, they were really good, very reflective of the exam. They have a lot of knowledge, and the explanation is usually short and condensed, which was really also useful. So these were baseline for me. With regard to the essays, initially I started doing essays from the Blood Academy. The structure of the essays there is it's not. I don't want to say it's bad. It's good, but it needs to be. You need to take in your mind that this is not the format that you will use to answer in the exam. They write very good information about the topics in general, but you would probably need to take that information and restructure the essay in a way that you can answer the exam question. The essays from pathology question bank were also I found it good to collect information from the essay answer, but not follow the same style of writing over there. Transfusion, I think if you are able to do the essential transfusion course at least before appearing for part one, that is very useful because the course is really good. It covers in depth actually the topics that you need to know for transfusion before appearing for part one exam. So if you are able to do that close to the exam, it will save you a lot of time and a lot of effort. I didn't need to review a lot of sources outside the course to be able to do the transfusion question. So this was a baseline for accumulating the knowledge for the exam. At that point, actually about 2 to 3 months down the line from when I started preparing, I was looking for courses to sort of familiarize myself with the technique of the exam because at that time I didn't know how to structure the guide, how to structure the essay questions, and how to approach the MCQs. And that's when I received the link to join Dr. Amir group from one of my friends. And I really found it very useful. The MCQs, which are designed by Dr. Amir, are really good. They are focused on high yield topics for the exam. And the way that the MCQs are presented is actually very good. I know the exam questions will come as a very long, detailed MCQs, which is not the same as the MCQs in Dr. Amir course. But the topics are the ones which are high yield in the exam. So what I started to do is to answer the MCQs which were shared in the group, and then to go and review the topics behind these MCQs from the BSH guideline or from the sources that I have previously mentioned. And I think this was really useful to cover a lot of topics during the preparation time. And with regard to the essay structure, I believe the structure that Dr. Amir gave for how to answer the questions, what are the points to put, the helpful mnemonics. I'm not a very big fan of mnemonics because I get them confused all the time, but at least one or two mnemonics, I kept them in my mind and I use them, which was really, really useful. So once I attended the first session on how to structure the essay in the exam, I followed that structure in all my subsequent preparation. So I visited again all the topics and I started just writing by myself, even not the essays that were shared in the group or on Saturday sessions, but I just started to write essays on myself, choosing a topic and then writing about the diagnosis, the investigation, how to approach the management. And I think that helped me a lot to fix that structure in my mind. And later on, made it easy for me to focus on doing typing and other stuff and fixing the time as well. The course was very good, excellent. I by the end of the course, I felt like I don't need to go for any other courses. I really believe that this was sufficient and enough with regard to the topics chosen for the course, with regard to the examples for the essays, how to structure them, and the input in the courses. That was really useful. It was really helpful. I went through that material after the course again about 2 to 3 days before the exam, and that was, I think it was a real game changer for answering the exam questions. I didn't do the mock exam just because I was busy during these days, but I think it's very good idea to try putting yourself in the real exam situation and get a feedback on that before you appear in the exam. I think that will be really useful to pinpoint the areas that you need to do more effort on before appearing in the exam. As my previous colleague said also, I believe most people, when they start preparing for the essay questions early on, by the time they sit for the exam, they have no problem answering the essay questions, because essays in the exam are standard topics. Most of the time, nothing weird comes. The questions, they just kept, the topics keep repeating. They are very high yield topics, so which keep repeat appearing in the exam. So I think if you cover them during the preparation course with Dr. Amir, and then again in the intensive course before the exam, you'll probably have no problem approaching the essay questions. The MCQs in the exam were difficult in terms of the number of the MCQs. The stem is usually long. The knowledge tested in the MCQs is really deep knowledge. It's not very superficial knowledge or anything. You need to have studied well for answering these MCQs, especially transfusion questions, which are quite long. And you really don't have enough time to think a lot. You'll probably have a minute or a minute and a few seconds for answering each question. But again, if you cover the MCQs in Pathology Question Bank, Plot Academy, and review the guidelines well, I think probably you'll be able to answer at least 60 to 70% of the MCQs presented in the exam. The last days, I think everyone probably should plan to take an exam leave at least 5 or 7 days before the exam. If you can add to that by taking an annual leave and keeping yourself about 2 weeks before the exam relaxed at home, not worrying about anything, and finalizing your preparation, that will really be good. During the last months, my approach to the exam was to give 1 week for each discipline. So I spent 1 week in hemato-oncology, 1 week reviewing hemostasis thrombosis, 1 week for general hematology, and I reviewed the transfusion topics last because the knowledge in them is difficult to remember, and you can easily forget it if you review it a long time before the exam. So I just focused on reading these the last few days before going to the exam. The exam itself, I hope that for the next sitting there will be no IT issues. The exam structure now, the essays appear as a stem question followed by a box in which you will write your answer. I'm not sure how it was previously. I think maybe previously all the questions were there and then you have to write the answers separately. But now each question is followed by a space and you have to type your answer in this space. One of the things I noted in this sitting is that some of the questions in the essay were sort of direct questions. I'm sure that during your preparation for writing the essays, you will find that most of the questions that we prepare for in the courses focus on, for example, the management question of the patient. So it will be various steps talking about breaking bad news, giving sources of information to the patient, explaining the diagnosis, the physical exam history, investigation, management, contact with CNS, blah blah, etc. etc. So I felt like the questions sometimes I don't want to reveal certain exam questions, but they were very direct questions in the essays this time. For example, a question will be like, from the current guideline, please outline the first line treatment for this patient. So it's a very specific question that you don't need probably to write a lot of things. So I think people should pay attention to the type of questions being asked it's not always a general question that you need to write 100 point in the answer. Some of the questions were very direct, like just give this answer. So these may appear in the exam in subsequent settings, and you need to answer them accordingly. For the MCQs part, the IT issues were very stressful, to be honest, because I have lost like 30 minutes from the exam time. So I think time management is very important for the MCQs. You should not probably spend more than a minute or and a few seconds on a question. If you couldn't know the answer, just move on to the next question. I believe that's all that I wanted to share. So I'm happy to answer any questions if there is any.
Thank you very much, Khalid. The questions are there for you in the chat box. You can answer them.
Okay. Let me
Right.
start in the chat.
Yeah. Meanwhile, I will request the next speaker.
Yes, somebody asked about how long does it take to go through the question bank, pathology question bank. It's long, actually. It took me about 3 months to go through it, and I was doing about probably 40 to 50 questions a day. So you need to start that one early if you want to do it. The Heme base, as I said, it's a very good for checking the basic knowledge, but you'll probably need to update yourself on many topics from the guidelines. Yeah.
Thank you. Now we will request Manor to say something. Thank you, Khalid.
Hi,
Thank you.
Dr.
Thank you so much. Yeah.
First of all, I have to thank Dr. Amr so much. I don't think I would have passed the exam without Dr. Amr and Hematomorph support. And I really advise all my colleagues attending today, don't lose the chance of getting all the knowledge Dr. Amr have and all the support that he offers, because it's very difficult to get this type of support continuously. So make sure that you really take all the resources that he gives, all the sessions into consideration. I know my colleague have covered a lot of things, but I will just go through very quickly, very important points. Maybe for me, working, having family, and I know this is the same for a lot of you guys, is very difficult. So I wouldn't have made it without a study group, and I would advise everyone who might be like me in my situation to join a study group. The more the merrier. Okay, as much people as possible, and the only reason is because you will not be able, like if you're 2 or 3, one of you is not there, only 2 is there, you will feel like, okay, we're not good enough, and then you're going to drop. So that at least when someone is absent or on call, you have enough numbers to keep on going. We used to study every night from the moment that we decided, and a lot of the times we fell asleep while revising. So just make sure that you be.
Hello.
Yeah, can you hear me, Dr. Amr?
Yes.
Just to be very committed to a study group. This is very important. I think maybe it's one of the key elements of why you can make this exam pass. What we used to do as well is when Dr. Amr posted the questions, so Dr. Amr would post the essay for every week. And I found it a bit difficult to answer all the questions myself, so I'll try to attempt the question myself, and then I would go and ask in the group, guys, did anyone manage to find where to answer this? I couldn't find it in the guideline, or I couldn't find it there. We also discuss after the sessions on Saturday, did you understand that? Dr. Amr always explains very clearly, so if anything was missed, by me, they would have noticed, okay, Dr. Amr said that. The recordings are amazing as well, so listen to them again and again. Like I think Najwa was saying that sometimes while I'm cooking, sometimes while I'm just sitting with the kids, studying with them or something, I'll just open the recording, so the sessions just to listen to them. The topics, one thing keep in mind is the latest guideline always comes in the exam. So there is a lot of new guidelines. So look at them before the exam, make sure that you know them by heart. One of the very important key points that I want to tell my colleagues as well is that MCQ is continuous for 3 hours in the exam. So you cannot be practicing MCQ maybe for an hour and then go in the exam and expect your mind to be able to give continuous 3 hours of MCQ. So you have to build up. I think what we did was we started with 20 questions a day, and then we pushed it to 40 questions by the time that the months before the exam. You just do 100 so that you can run the 120 MCQs. Do not, if you can by any means possible, please attend the mock exam. The mock exam will show you how much stressful, how much the time is very long, how strain, and it requires a lot of energy to do, so that you're not shocked at that at the exam day. It's very, very important. I attended Dr. Amr course twice. If I can, I would attend Dr. Amr course 10 times. We cover all the topics in 2 days in a very systematic way. If you can memorize what he says, you're sorted for life. And I'm not kidding. Dr. Amr resources also for the miscellaneous, this tiny tables that he did for the molecular analysis, for the flow cytometry, for the medication, mechanism of actions. This is life-saving, and it's high yield, and it's definitely MCQ. And then the fact that Dr. Amr posts a question, 2 questions MCQ every day makes your mind continuously going. So make sure that you attempt these questions as well. I wish everyone best of luck. It's not an easy exam, and if you decided that you're going to go for it, you have to go in depth. It's like all or none rule. You cannot be just going to the exam, paying the money, but not really studying. I asked one of my seniors one time before the exam, it was 4 months, how many hours should I be studying? And he said 4 hours for 4 months is at least, and he was not joking. It's a real thing, so you have to really push hard. It hurts to pay the money and then have to pay it again to attempt the exam, so it's worth it to do it one shot. And again, thank you so much, Dr. Amr. Honestly, thank you so much. And best of luck for everyone else.
Thank you, Manor. Good luck for your part 2.
Thank you.
Do we have Amy here? Do we have Kelly here? Sorry. Do we have Sukanya here?
Yeah, I'm here.
Yeah.
Hi, Dr. Amir, Sukana here. I'm one of the hematology registrar training from King's College, and my heart is filled with gratitude and thankfulness for Dr. Amir's guidance and support and continuous encouragement throughout this exam preparation. So going up point-wise, the first point is duration of preparation. As we all know, like everybody is and or like doing rotas, on-call shifts and weekends. So I started preparing mentally 6 to 7 months ahead, but I had blocks where I had to do nights, weekends. So intensive preparation would be from 4 months, but I did join Dr. Amir's course sometime in June, went through the first initial guidelines or the way he advised us how to go ahead. And in the study partner, we were 4 of us from different parts of the country in the UK. And we all used to take turns in reading some guidelines. And we used to do like 10 minutes to 15 minutes presentation about each guideline we were reading in detail. Because as some of our colleagues were already saying earlier, to read A to Z of all guidelines by each of us was not possible. So we used to take pick up few guidelines, each one of us, read it and make some points and discuss. And then we try to attempt Dr. Amir's weekly sessions on Saturday morning as much as between, and if one of us couldn't attend, then when we're on call, then the other used to attend and give a feedback on it. The recordings of Dr. Amir's have been very helpful. And I was not that very studious enough to send my questions, essays to him, which I regret now when I reflect on it. But I did attempt the mock questions, and his feedback was very helpful when I was writing the essays. Sources used. So as I say, BSH guideline, we used to read one couple of each of us in a week. we used to read the guideline totally and then go to the recommendations and then discuss it. And then if there's blood education podcasts on those topics, we used to listen when going to work or coming or whatever, sitting at home after work. And then going through the topics in Dr. Ami's YouTube sessions when we were joining, then there was in that cusp of where the YouTube sessions were there before the Hematomorph website was opening up. And after going through, then we used to read the heme-based guideline, because when you're writing the answers, Dr. Ami's session is very good to give you a head algorithm, and heme-based just to give like the pointers to remember. And then we used to go to the part question, the MCQs, and the explanation part questions are good enough to just consolidate the information. But overall, Dr. Ami's online session, his reading material had been the, the final reading through for the exam. So Blood Academy was one, we registered for it, but we didn't use that much of it. We just went through the answer, like the essay question, it is like 16 to 17 topics. We just went through to see if we were missing something, but I think in the long run, we didn't miss anything. We had covered everything for Dr. Amir's questions. Then courses, we did one or two like face-to-face course, which happens in London, but those were too high, I would say, for our level. They were good sessions for education, but maybe not from an exam point. Personally, I feel that maybe if you're nearing CCT, then it would be good to attend some specific sessions similar to that. But I didn't think for this exam, Dr. Amir's session was more than helpful. A mock exam, yes, I did attend Dr. Amir's mock session, both the MCQ and the essay ones. And it really helped because it was like a complete exam setup. Be in a room, quiet room, attend to questions, have a break, and then do the MCQs, and the video camera was on. So you were in that same adrenaline rush to finish the exam on time. And the individual feedback which was given was very helpful. It was full marking and what needs to be done. And I did a blunder or two in one of the essay questions, and he really opened my eyes to say, don't write this. And so it really kept my, and he had some very good mnemonics, which my colleagues are mentioning. So basically, he kept on reminding us on those mnemonics, even I think 24 hours before the exam. So it was in my brain, like I have to remember those. And his reading material was excellent, is excellent. Even I remember he saying to us, like, remember by heart the miscellaneous points. And I just read through and I just remembered, print out those paper sheets and put it on my fridge or in my study room, and just remembering it was so helpful. And the last days of exams, we were going on revising in our group until 7 days before the exam. We used to pick up topics, and specifically we used to look into the 5 years questions back, which the topics came and which are supposed to be possibly to be come back, because you'd expect like the last three HEMON questions or the topics might not come, but it still might surprise us. But we used to make sure that we are actually covering the topics which have not come, as we aren't going to miss on those. And feedback on writing those essay questions and attempting the MCQ. Even when I remember when I answered the MCQ question, Dr. Amir kindly wrote in my MCQ feedback that to concentrate on certain topics, because I think I was doing wrong on those, and that really helped me pick me up. And the exam day itself was very stressful. We started our exam, mine started like 1.5 hours late, and we were already going with an adrenaline rush. But somehow I feel being in that same setting just a couple of weeks before, uh, kind of, I don't know, it can kind of calm your nerves when you started to write your first question onward. I did not get any break between the essay and the MCQ. The computer started switching on for the next session automatically, so I had to keep on going. And Dr. Amir's MCQ website, it was helpful because what I did was just I kept on answering his questions as much as I could regular, but in the last 10 days before, I did his whole MCQ sessions in a like mental examination setup, because his questions are very good and lets you intrigue your brain. So I would be wrong to say that his session or his teaching did not help. It helped me 101%. And I'm looking forward to take his guidance for my part two preparation. And we have at King's, we have already few of my colleagues have already joined his course, and some of them are joining again for his advice in March. And I really thank for this opportunity for letting me share this experience. But thank you once again, Dr. Ami, and I wish you all the best while preparing for it. Please go through whatever he teaches you, whatever he asks you to go through, his questions, answers, and his constant support and his encouragement really means a lot. It's not just 2-day course session, that's it. He's there with you through the whole journey, and you can always ask him questions even in the middle of anything. And I'm really grateful, and I wish him all the best, and I look forward to see you in the part 2 preparation, Dr. Amir. Thank you once again.
Thank you, Sukanya, and good luck for your part 2 exam.
Thank you. Thanks a lot.
Do you have Abdul Wajid?
Hi, good morning, Dr. Amir. Good morning.
Good morning.
Yeah, my name is Abdul. I'm one of the ST4 trainees at West Midland, Birmingham. So first of all, thanks for giving me an opportunity to speak in this wonderful platform. Regarding my preparation, first point, duration of preparation, yeah, somewhere between 3 to 6 months, especially given that we have on-call commitments, work commitments, family commitments, everything. So probably start around 6 months because it will take a bit of time to get into the exam mode, and last 3 months probably more intensive preparation, I would say. And then we had a excellent study group. I think Sukanya was one of my partner in that group. So fortunately, we all passed the exam. So create like small groups of 4 to 5, and then revise guidelines, discuss between yourself. That'll be a good thing to do. And sources used, yeah, first thing was obviously the most important is BSH guidelines for essays. And if you look at the last exam, like all the questions were from the recent guidelines, last 2 or 3 years. But the only thing is transition, it can come out of guidelines also. But recognize the pattern what they are following, usually, especially for malignant thing and all. Usually they kind of tend to change the pattern. If they ask myeloma thing next time, probably would be a lymphoid essays. And then if they ask a thrombosis thing next time, probably would be a coagulation thing. So be updated with the last, I would say like 3 to 4 years of BSH guideline thoroughly, and make sure you go through the other important guidelines also. It may not be possible to go through all the guidelines of the last 15 years, but make sure we cover the important ones. And then for essays, obviously, Amis weekly sessions were of immense help. Although I couldn't, like, maybe we might miss some of the sessions, but I made sure like I go back to the videos in Hematomorph and revise those essays and write it at some other time point also. So those essays were of like essay sessions were of real help for me. And for MCQ part, I started like doing some of the MCQs which they post in WhatsApp groups, and then again when the group changed to Hematomorph, tend to attempt all those MCQs. Apart from that, Path question bank was really good. Those two are the main MCQ preparation for me. And in exams, like MCQ questions were a bit tricky. Essays were like quite straightforward, I would say this time, but MCQs were a bit tricky. Probably there'll be like a lot of like 50% of MCQ would be like pretty straightforward, but at least 30% would be like very tricky, especially the long thread ones, and 20% would be kind of intermediate. Courses, I didn't do courses, but from the feedback given by my colleagues, Sami's course was really excellent. I did a course in London. That was the course which I did. Mock exams, again, I didn't do any mock exam, but closer to the exam, usually I practiced essays in 3-hour time point, like different essays. 4 essays I try to write so that to get used to the exam system. In last days of exams, I had like a couple of weeks of study leave and annual leave. So I stopped learning new things probably around 15 days before the exam, and then concentrated on revising the topics which I have already covered. That's really important because the main thing is like you have to memorize what you have learned. So you have to at least go through like the guidelines 2 or 3 times so that you will not forget important recommendations or points. So that's really important to revise for the last couple of weeks. Give 2-3 days for each disciplines and revise it thoroughly. Exam itself, yeah, obviously this time it was quite stressful, but I was lucky enough, like I did get allotted time for my exam, both in MCQs and essays, although there was a delay in starting. Like you have to wait. I think all of us had to wait for 1.5 hours before the exam started, but didn't have any technical glitches once it started. But that is not the case for many of my colleagues. It was really stressful for most of them. But yeah, I would really recommend his MCQ sessions, MCQ questions posted in WhatsApp and Hematomorph group, and also the weekly session. That's really helpful, and thanks a lot for guiding to pass this exam. I wish all the candidates good luck. Thank you.
Thank you, Abdul. Good luck for your part 2 exam.
Thank you.
Do we have Shabana here? Shabana Kosa. No. Your voice is very low volume. Can you speak up a bit, please?
Okay. I'm Shabana from Pakistan. Thank you so much for providing the platform to prepare and pass in first attempt. Keeping in view the theme of this session, the duration of preparation, I started my journey 1.5 years ago, as I have another commitment and it's not very regular in my preparation.
We cannot hear you, Shabana.
I think there's some connection issue. I'm speaking up, but I think the voice is very low and it is not being transmitted very well. Hello.
Yes. If you can try again, please.
Okay. I'm Shabana from Pakistan. Thank you so much, Dr. Amir, for providing this platform to prepare and pass in first attempt. Regarding the duration of preparation, my exam journey started 1.5 years back because I was not regular in my preparation. So it seems quite a long time for preparation, but I had very long breaks. But after the last autumn exam, I became a bit regular and I started reading off BSH guidelines and after that, Haem-based summaries. Initially, we were 3 partners to study, but one dropped off and we 2 continued till the exam. But unfortunately, and I hope she passes in first attempt too. Regarding the sources of exam which I used for essays, it is Dr. Amir's essay sessions. I had been very regular in my essay sessions. I kept posting the solved essays to Dr. Amir and getting the feedbacks. And I used to, if I missed any online session, then I went back to the videos. I played it again and I edited my essays as per Dr. Amir's directions. So by the end of the preparation, I had a very quite a pool of essays to go through before exam for revision. So for essays, I recommend this weekly essay session because other sources I did not find very convincing, like Flood Academy or Path Bank. It didn't help me a lot, but this weekly essay sessions really helped me a lot. For MCQs, I followed channel MCQs, Flood Academy, Path Bank, and one of our colleagues in the last exam journey session told about that FRCPath questions were very quite close to the exam MCQs. So we subscribed for this session as well. And I find it helpful for the exam MCQs. Initially, the channel MCQs were very simple. They have low difficulty level, but with the passage of time, I had been following it even after the exam. The difficulty level has risen up, and it quite mimic the exam questions now. So only Dr. Amir's essay and MCQ sessions will be of helpful. Then comes the courses. By the courtesy of Dr. Amir, I attended the courses just the crash course just before the exam, and it gave me quite a quick revision of the essay material. I attempted only the mock essays, which put me in real exam pressure, and it helped me improve my time management skills, and it was quite reassuring in the exam, as I had been able to attempt the questions within time. Although my last question was not complete, I missed one part of the Cartesian question due to the system failure. My screen got frozen and I could not attempt after that. But alhamdulillah, I went through it thanks to Dr. Amar as well. And regarding the last month and last phase of exam, during the last week, I dedicated 1 week for each section. And after completing each section by going through NSSPT and DSS guidelines, I attempted the different sources of MCQs because with near exam, you cannot go to MCQs really well. And during the last few days, I went to the essay pool of mine as well as the course exam material. I went to the study material which Dr. Amir shared, and it was very high yield. All the MCQs regarding translocations, mutations, antibodies, treatments, and other factor concentrates, things like that. It was all from that course material. So I highly recommend this course to be attended by the fellow colleagues. And regarding exam day, it was very stressful. Exams are very stressful, but this time it was the system which made it even worse. So as I had been very regular in the sessions and preparations during the last few months, so MCQ session went very smooth, and I was confident, and I most of the questions I knew that and I was confident enough to mark the answer. But the extended matching questions were quite tricky, and I have a suggestion for the group to kindly add extended matching questions as well to the tool. It will be very helpful for other fellow colleagues to go through the exam in the first attempt. And in the end, I will need for me to get through the exam in first attempt, and I hope to get to the part two in the first attempt.
Thank you, Shabana. I will add the extended MCQ to the tool. Your connection was a bit tricky, but we got your message. Thank you. Do we have Ambreen Kashif here? Saima Afridi. Kelly, are you online, Kelly? Amy, if you are there. And the last one is Sabrina. Sabrina is a candidate from Iraq. She's not online. Okay, so these were the few speakers who could speak and share their experience with you. Hopefully, you all would have got the message, what to do and when to prepare. If you have any question, please shout out. If no, then we can wind up the session. We will have a session from part two candidates to share their experience. So please join us tomorrow as well. Thank you all and good luck for part two. Good luck for your part one exam and have a nice weekend.
Thank you.